medical practitioner based here in London, in the UK. And today, our topic, or the topic I want to share with you, is named heart block. Now, when you talk about heart block, it doesn't really mean that your heart has stopped beating or working completely. It doesn't mean that at all. I'm going to look into that and trying to break it down for us to understand what is really heart block. We will get to know that heart block actually got three types. There are three types of heart block, and each type has its own symptoms. So we'll look into that as well. And we'll also find out the causes of these heart blocks. So let's stick around for the next 20 minutes to understand this new topic here. Like every week, every Sunday, we have a brand new topic to open our understanding about ourselves. Now, if you're listening to me, I can give you the number straight away. Possibly you don't have any problem at all, but maybe someone else needs help. Take this number, okay, and share the number, and you'll be a blessing to that person. I'll put a number on the platform very, very soon. But now let's try to understand what is heart block. So let's have an overview here. You see, your heart isn't plugged into an outlet or a socket to really get that electrical help, your heart. But of course, the heart naturally runs on an electrical system, but it doesn't have a switch to switch on for these electrical impulses to go through your heart, for your heart to contract and relax and pump blood in the body. You see, blood is the life of the flesh. It contains all the nutrients and the oxygen our organs, our tissues actually need. So it's very, very essential for us to have a very strong heart, a heart that is efficient, a heart that beats beautifully. If your heart beats beautifully, you'll be in a healthy body. You see, let's try to understand a little bit the anatomy, the structure of the heart. The heart got four chambers. We have the two upper chambers, and then the two lower chambers. And then, the upper chamber there on the right side, there is a very important specialized cells. They are known as sinoatrial node, SA node. They actually form that natural pacemaker. That is where the heart generates electrical signals or electrical impulse, right? That goes through also specialized cells. These specialized cells can be found between the upper chamber and then the lower chamber. That in between that, we have special cells. We call that the AV nodes. This AV node, it serves as like a bridge between the upper chamber and the lower chamber. So when the electrical impulse are generated from the top chamber, it goes through the bridge, that AV node, and then in turn, it sends or transmits that signal to the lower chamber for the heart to contract and then relax to pump the blood throughout the body. I hope we are in the picture. You see, a heart block occurs if the transmission of the impulse between the AV node, that is the bridge I'm talking about, and the lower chamber is interrupted or is disturbed. So it can mean that the signal can be very slow, get into the lower chamber, or in some sense, a third-degree heart block, it can stop completely, the transmission can stop. So this is what we call the heart block. So heart block is just simply the interruption of electrical impulse from that bridge, the AV node, that is the bridge between the upper chamber of the heart and the lower chamber. That transmission from that bridge to the lower chamber is disturbed or is interrupted. And sometimes it slows down or it can be cut off completely. All right, that is called the heart block. And when it happens, it's a real problem. And to some extent, it can be fatal. It's a life-threatening problem. Okay, so as we move on, if these signals stop completely transmitting to the lower chamber, you see, the body is so complex, so intelligent that there is a backup system that can take over, but this backup system is unnatural if there is a cutoff of transmission from the bridge to the lower chamber. So what happens is that if there's a cutoff and there's a backup system, the system is unnatural, so the heart will be beating very slowly, very slowly. We call that bradycardia, and that can lead to the body's organ and tissue becoming deprived of oxygen. Okay, so then you see that the person wouldn't feel strong, wouldn't feel active, and that person may experience some symptoms like dizziness, fainting, tingling, numbness, and so on, because that individual doesn't have enough blood flowing in the body. Now let's have a look at the types of heart block. But before I put the types on the platform, let me give you a telephone number that you can reach me in case you have any heart problems. It may be heart block, it may be heart failure or enlarged heart, it may be any heart disease. Just reach out, or diabetes, arthritis, derma problem, that is skin problem, hair loss, it could be kidney disease or hepatitis. Just reach out and just get to me. Even if it's not you, just share this number. Be a blessing to somebody, and your life also will be blessed. While the number calling outside the UK is +44 738 464 7300. This number within the UK is 0738 464 7300. So this number is WhatsApp, so you can WhatsApp me, or you can just call me directly. I also provide online consultations. So for those living in Australia or Canada or US, you can travel here. It's possible for us to have an online consultation, and then of course sending you anything that you need by post, by DHL. It can reach you easily. You can also visit me on the YouTube. Put in Dr. James Natural and Dr. James Natural on the YouTube channel. You can get a lot of presentations there, and share the presentation to be a blessing to someone. Subscribe so that you don't lose future programs, and then press the like button, click the like button to support this program. You'll be a blessing. Be a blessing. Thanks a lot. But now let's come to the types of heart block. Now there are 3 main types of heart block. Now we have the 1st degree heart block, 2nd degree heart block, 3rd degree heart block. Let's have a look at the details now. The 1st degree heart block, what is it actually? A 1st degree heart block is where there is a split second, just a split second delay in the time that it takes electrical pulse to move through the AV node, that bridge I'm talking about. That is the special cells between the upper chamber and the lower chamber. That borderline, that border there is called the AV node. That bridge, it serves as a bridge that for that signal, even if there's a split second delay in the time that it takes electrical pulse to move through that, to get to the ventricle, that's the lower chamber, then of course this 1st degree heart block can develop. All right, and then we said the 1st degree heart block does not usually cause any noticeable symptoms at all. And officially, when you go to hospital, traditional hospital, because you don't feel anything, like serious symptoms, it is ignored. But is rarely treated. It's not treated at all. But you see, why would you ignore something that can be very serious because it starts with the first degree. It means that it can go to second degree and third degree easily. So when anything starts in the body, it's not only regarding the heart, it can be anything. You shouldn't take it for granted or ignore anything. And that is where women in general, they are very, very good at it. If anything slightly happens to them, they try to cross-check and try to work on themselves. On the flip side, most men, I'm not talking all men, but most men will wait until it becomes very, very, very serious before they actually move or that they take a move. But well, we shouldn't waste any time because diseases only develop, they only move forward. Right, let's come now to the second degree heart block. A second degree heart block is where there is a series of increasing delays. There's several delays in the time that takes the AV node to send the pulse to the ventricle, to the lower chamber, until eventually the heartbeat is skipped. You see, so when there's a series of delay, there's a skip in heartbeat. And when there's a skip in heartbeat, it means that blood may not go around in your body well because there's a skip. Or if you experience any palpitation, it means that your heart is not efficient pumping blood in your body. So if you experience palpitation or a skip in heartbeat, it means that you have a reduction of blood volume in your body. And your organs, your tissues may not be receiving enough oxygen with nutrients well. Now let's come here in the second degree heart block. We got two types. The first type is actually not too serious. I quote that officially. Why? Because it gives very mild symptoms, mild dizziness. That's why they said, well, it's not serious. But you have a mild dizziness, you shouldn't joke with it. You see, so nothing just happens. Something happens, you know that there's something behind that. And what is developing? Your heart is becoming weak. Because most dizziness is because you don't have enough blood getting to your brain. So if you have a slight dizziness, you shouldn't joke with that. You shouldn't ignore that at all. So that is the first type of the second degree heart block. But the second type, the symptoms become a bit more serious. Normally you feel lightheadedness and dizziness and fainting. Sometimes in some individuals you may faint for a few seconds. You go completely blank for some seconds. You don't know where you are. It means that you're experiencing syncope. That's blood not getting into your brain. And that can be a real problem. So when you see those, you have to really have a serious attitude to it. This is the second degree heart block. That's what I've spoken about, the second type here. Now when we come to the third degree heart block, a third degree heart block, or sometimes it's named complete heart block, is where there is no transmission of electrical pulse between the AV node, the bridge I'm talking about, and the lower chamber. That's the ventricles, the lower chamber. So there could be a real restriction of pulse from that bridge, from that AV node to the lower chamber, right, or the lower chambers. That's what happens. Now, as we look at the second degree, got two different, subtypes. Also, the third degree got also two subtypes too. Now, the type here is congenital. That is where the condition is present at birth. It's not too common. That is where there's a birth defect. It's not common. But the second one, that is acquired. Acquired is where the condition develops as a result of heart damage. That with time, as you grow. So it doesn't happen at the birth, but it happens because of your lifestyle, because of certain medications, because of maybe stress, because of maybe clogging of your arteries, because of operation, whatever, of some medication, because of that. So it's something that is acquired with time. So a third degree heart block can cause a wide range of symptoms, some of which of these symptoms can be really life-threatening. Now, this type of heart block is usually regarded as a medical emergency and may require immediate treatment. Normally, when you have for a third degree heart block, you go to the hospital, you have to consider that they're going to give you artificial pacemaker. Artificial pacemaker, because it means that you're not transmitting the pulse at all, the electrical impulse from the brain to the lower chambers. You may not be transmitting it properly at all. And so they give the person pacemaker. But a pacemaker is management. It's a management of your heart. But it means that if your heart structure is changing, is weak, is enlarged, it will continue to enlarge. It means that this pacemaker, the artificial pacemaker, is working on your behalf. And you left the heart gradually to die off. So you shouldn't depend on that management. You have to strengthen the heart and get your heart back. You get your heart back as soon as possible. Right, let's have a look at the symptoms of the heart block. The symptoms of heart block vary depending on the type of heart block. As I was saying, the first degree heart block is that you don't see any symptoms at all. And normally they find it by accident during, let's say, a routine electrocardiogram, that is ECG, and they may even see that the heart rate and the rhythms are usually normal. And they may say that it's okay, you're just fine. But you have a slight problem, and they can let it go. But then it continues to develop, it moves forward. So you see, the category of people, the third degree block is common in athletes, people that are really sports people, strong sports people, or teenagers, or young adults. So these category of people normally suffer the first degree. And you're going to ask, why? They do a lot of exercises. They are supposed to be fit. They are supposed to be strong, healthy. No, because if you overdo exercises, if you run for too long, you do vigorous exercises, what happens that your heart becomes enlarged. And even over-exercising can lead to reduced immune system. So too much of anything is bad. Definitely is bad. So exercises should be moderate. It should be moderate. Now the second degree here is normally that's when the person is fainting, feeling dizzy, chest pain, because blood cannot go around well effectively to come back to the heart muscles. So there's a pain in the heart, feeling tired because of low oxygenation, don't have energy. Shortness of breath, especially when you go uphill or you go by the stairs. Heart palpitation may be experienced. You may experience also rapid breathing and nausea. You see, so this is kind of a typical symptoms of a second degree heart block. But the third degree heart block, everything I've said, dizziness, fainting, chest pain, feeling tired, shortness of breath, and also slow heartbeat. Everything I've mentioned will be intensified in the third degree heart block. These are the symptoms. And as we're saying that, the third degree heart block is a matter of emergency. When you rush to the hospital, they will give you pacemaker. That is what happens. And it's a life-threatening condition. Normally, some individuals may have their heart stopped. The heart may stop suddenly. That's the sudden cardiac death or sudden cardiac arrest. The electrical part of the heart may stop. And the person normally, we say the person died from natural cause. He may die naturally in sleep, in his sleep or her sleep, or may die even while sitting in the car or sitting down in the office. It happens. It's not something that we should take it for granted at all. Now, what causes it? What are the causes? As I say, the first degree heart block is caused by the category of people that over-exercise. When you over-exercise, the heart becomes enlarged. Teenagers, young adults, Normally, these are category of people that are supposed to be very healthy, but they're not healthy because the heart structure could change because of many reasons. Okay, but especially because of overdoing exercises that can cause really first degree of heart block. Other causes of first degree of heart block is that myocarditis, it's mean inflammation of the heart. The heart can be inflamed, and that can cause that. It could be inflamed because of infection, because of even dental problem. I always say on this platform, dental problem can lead to inflammation of the heart, and that can cause first degree of heart block. Low levels of potassium and magnesium can also cause first degree of heart block. And certain medications that are given for heart problems. When you go to the hospital, you have a heart problem, they give you medicine for heart problem, and you also have the symptom is having heart block. Can you understand that? Medication given for high blood pressure is also noted that it can also cause heart block. That is the first degree of heart block. It's a research finding, right? And so medications that are also necessary to treat heart failure. When somebody has heart failure in the heart, it goes to the hospital, is given medication for heart failure, it can also cause first degree of heart block. You see what I'm talking about here? Now the second degree of heart block here, also saying that children may have congenital heart disease. It's not too common, but it does exist. But there are other causes of the second degree here. That is a damage that developed during a heart attack. So when there's a heart attack, the heart muscles will not be the same. So it can develop the second degree here. And then also some bacterial infection. It's called a Lyme disease. It can also be spread by ticks. It can also cause that. Now, I was also saying medication to treat blood pressure and abdominal heartbeat. It can also cause that. And then, of course, medication that are used to treat pneumonia at the traditional hospital, it can also cause that problem. The third degree of heart block is acquired. It's normally acquired, something that you get with time as you know in life. Many cases of third degree heart block are caused by damage to the muscles of the heart. The heart muscle can become damaged for a number of reasons. You know, it can be a complication of heart surgery. After heart surgery, there is an abnormal problem of the heart, abnormal heart problem. So the complication of heart surgery is there. And then the coronary heart disease, it means clogged arteries. Your arteries become clogged, become narrow and stiff. It can cause this problem. And then also complication of radiotherapy. There are some individuals, they go to hospital, they are given treatment for conditions such as cancer or thyroid disorders or some blood disorders. And this can be also, there's a consequence, it can be a third degree heart block. You know, also bacterial infection here can also cause that problem. The high blood pressure, that is not, I wouldn't say control, that you don't get rid of, finding the root cause can also lead to third degree heart block, all right? And then of course a penetrating trauma to the chest, such as a stab wound or a gunshot, of course, is very unusual. But the medications to treat blood pressure or depression can also cause a third degree heart block. You see that the very medication given to you at a traditional hospital can cause heart problems. Even those that are used to treat your heart can give you also intense heart problems. And you know, today our eyes of understanding has been opened to heart block. We understand now what is heart block. We know that it's not just about the transmission of the impulse or the electrical signal from the bridge, that's the AV node, to the lower chamber that has been disrupted. And that either it delays it, it slows it down, or completely cut off. We now understand it. It's very clear. Thanks a lot for joining me today. And I look forward to having you around on this platform again next week with a brand new topic. May God Almighty smile upon you this coming week. And I appreciate your companionship. And we're going to have another beautiful time next week. Goodbye for now then. And then see you around next week then. Goodbye.
Get deep.